Good morning. Welcome. We're going to go ahead and get started in just a second. Actually, the getting started will be just me giving some housekeeping um, things, but welcome. My name is Nancy, or I go by Nan, and I am virtual support here for ACHE. So I welcome you. I will be here for the duration. You can reach out to me in the chat at any time if there's something you need. We are recording, but welcome to today's virtual interactive discussion brought to you by the Healthcare Leaders of New York. We're really glad you are here. We want to go over a few items that will help you navigate this program if you haven't been in one before. Got a good sized group, so I'm still admitting people. So just so you know, if you see me looking up, I'm looking at the waiting room. Um, we are being recorded though, and this recording will be available in approximately 2 business days where you registered on the ACHE Learning Management System. The recording will be there. If you'd like to watch any of that again, you are able to. We also have a chat function for the event. So again, as I mentioned, you can reach out to me at any time. Go to the chat and you can put in whatever you would like. We also have that available for questions and answers. Just so you know, we have open Q&A at the end. We reserve time for that. But if you have a comment or want to put a question in during the session, feel free. We will be monitoring that, doing our best to either answer that as we go along, or we will hold those till the end. So just so you know, that's there. And in fact, if you want to give the chat a little try, feel free to reach out and let us know where you're joining from. I'm telling everybody I'm in Chicago. We're sending cold weather to the East Coast. It's going to be -1 is a high on Friday. So you get that in a couple days after us. So you're welcome. We will then go ahead and talk about the virtual interactive education credit. I know that's so important. We have 1.5 hours associated with the session. To earn the credit, please be logged in for the entire session. And you will then, if you meet the requirements and are on the event, you will see that applied within 2 weeks to your um, learning management system account with ACHE, where your courses are. It will have a certification where you can either print it or you'll see the amount if you need to then go ahead and report that. If you have any issues, you can reach out to ACHE customer service. So if you have any questions with that. The evaluation is also very, very important. We're going to go ahead and I am going to go ahead and put the link in the chat numerous times throughout the event. I will also give you time at the end to grab it. It's so important that you go ahead and complete that. It also can be found where your course is on the learning management system and is available for 7 days if you aren't able to grab it from the chat when I put that there. Okay, I'm done talking. I'm going to turn this over to Halim, who's going to get us started. Again, if you need anything, please reach out in the chat. And again, welcome.
Thank you, Nan. I appreciate the support from you and from our national chapter, ACHE. Welcome, everybody, to Healthcare Leaders of New York, first virtual interactive educational event of the year, AI, Insights from Selection through Implementation. My name is Halim Kaigasis, and I am the chapter president for Healthcare Leaders of New York. During this presentation, we will be led by our moderator, Rachel Lynn Spooner from Northwell Health, who is the Vice President and strategy for the Strategy Center for Virtual Health. This event will be offering 1.5 virtual interactive credits for each of the attendees. You will have those credits added to your account by ACHE. These are not self-reported credits, and you will be required to attend for the full time in order to receive those credits. With that, want to waste no more time on this interesting subject. I'd like to turn it over to Rachel to introduce herself and our panelists. Rachel?
Good afternoon, everyone. Thank you for joining us today. And I would like to take the opportunity for my esteemed colleagues and panelists to introduce themselves so that we can get started. Chris, would you like to kick us off?
My name is Chris Hutchins. I am currently founder and CEO of Hutchins Data Strategy. Previously was a Chief Data and Analytics Officer for a number of years, including time at Northwell Health, and more recently at LifePoint Health here in Nashville.
Excellent. Rebecca?
Hi, everyone. Good afternoon. Becca Urban, Hospital Operations Executive. My background comes from hospital ops at the vice president level, from Jefferson Health, Cleveland Clinic, and Summa Health. I also spent a majority of my time in the peri-op environment.
And Ophelia.
Hi, Ophelia Chu. I'm the Vice President for Strategic Innovation at Memorial Sloan Kettering Cancer Center. And my background is really more innovation focused. I lead an internal team of innovation experts. So we use human-centered design as our approach, but we're leading internally within our organization AI adoption efforts.
Excellent. So thank you all for joining me. As Halim said, please use the chat function for any questions you may have for our panelists. We'll give you some time as we finish to ask and answer those questions. As we get started, just for a level set for everyone here, when you are talking about AI in your organization and you're chatting with people, what are your assumptions about people's knowledge base, or how do you frame the conversation for them? Ophelia, would you like to start?
Sure. So AI has been, so there's been discussion of AI really starting across the organization in early 2025. I will say that it really started to grow and snowball as we came towards Q4 of 2025, and there's no doubt that for 2026 it's going to be top of mind for the organization as a whole. I think that my general approach is really acknowledging that not everybody has the same understanding of what AI is. And I think it's important that as we're talking with individuals, we get a sense of what is their current understanding of what AI is and isn't. And I think the other thing that's really important around our approach is really to be positioning AI as a way to empower, augment, and upskill our staff, really as a way to help them to do work faster, smarter, and better, and really to provide reassurance up front that this is not a play to replace everybody's job, because I think that's top of mind for individuals. So it's really about looking for opportunities to remove inefficiencies and manual work. And it's not just about AI, but also as part of that conversation, really thinking about automation. And so, but really, again, reinforcing the people side of things, right, which is about enabling staff to be able to do work that is more value added and that really takes advantage of their own expertise and knowledge.
But Chris, Rebecca, would you like to add to those conversations?
Carl, just a couple of points. I think you hit the things that are probably most top of mind for folks. The one thing I've been talking to people about recently is acknowledging that we have a trust erosion problem. Basically, in every human relationship that we have over the last 20 years, it's kind of gone to the level that it hardly even registers. So people are a little bit uncomfortable sometimes to raise their hand if they have a concern, if they don't feel psychologically safe. They don't want to point out a process that they have that could be a candidate for automation. So the communication, I think, is a really important thing for us to be thinking about. And we talk to leaders in an organization, make sure that they're aware of that, and they're thinking about, how do I start to get to some of these core things that'll help people to be comfortable, and they'll believe that we aren't trying to outsource their job to AI. We want to augment it. I think that's probably the biggest factor right now that I'm seeing. People are still a little bit uncomfortable with it, whatever their understanding levels are. There's still this underlying fear that they have, and it's really important that we address that as specifically as we can.
And just to kind of wrap on that, one of the biggest focuses is really the language use that both Ophelia and Chris mentioned. It's really easy to get very complicated and to go down rabbit holes that everybody has to continue to chat GPT on, like, what does that mean? And understanding the difference versus visual learning, et cetera. And so really being able to find a common language. If you're able to send your staff, both frontline and executives, through a AI bootcamp that is kind of homegrown and made, very much an opportunity to kind of develop that common language. My last kind of expertise and recommendation is Please do not say that you are deploying AI. It comes again with that negative connotation because everybody's coming from a different spot on it. If you are able to share the exact use example, and we'll talk about that throughout today, but really being able to say what you're going to do, again, to take all that fear and mistrust that has happened over the years in different areas.
That's all excellent points. A lot of change management going into this, just the awareness of we are not deploying something at global scale. We are deploying something specifically in a specific area and being able to communicate that very directly with our teams and our leadership. And as we're starting to think about this selection process, we need to start somewhere. But how do you think about AI solution selection? How do we distinguish between things that feel like hype and practical tools that actually make a difference? Rebecca, would you like to start with this one?
Yeah, absolutely. So it's really easy on understanding hype versus value. You can't turn on the TV, you can't go through Instagram, you can't show up at a conference without AI, and you're really just getting plastered with it at this point in time. And so really being able to understand again kind of what those use cases are and what you're trying to solve for is really critical. I think when you talk about the hype on it is, again, it goes back to that idea of mistrust. There's a lot of language that's coming out. There's a lot of really good conversations, but how do you get into the weeds of the problems that you're trying to solve? So being able to focus on standardizing your KPI definitions, understanding your data definitions. Data is something that healthcare has struggled with since before time, and that's really where that mistrust occurs is how are you going to change the answers with AI if your data is continuing to be terrible and being able to standardize your data beforehand so you don't have that garbage in, garbage out mentality that has occurred, but also really being able to ensure that you have a structured workflow in making decisions. For me, my biggest focus is being able to kind of standardize our intelligence level around it in our decision making and really being able to look at our workflows and determine what needs to be flexible and what needs to stay. It really should have a 70-20, 10% mentality on that. So 70% standardization, 20% being able to configure.
Excellent. I love that 70-20-10 for having some level of uniformity with a little bit of flexibility as well. Chris, Ophelia, would you like to add anything?
Yeah, I'd love to build on what Rebecca just shared. I think the other thing that's been critical to me in thinking about where to get started is actually a recognition that AI is not a strategy unto itself, right? It's actually an enabler to your strategy. So I think critical to thinking about where to start and where to deploy and where there might be value is to be thinking about what are the broader business and strategic priorities of the organization, and then starting there to then say, and then how might AI help us to actually achieve those objectives and outcomes so that you're not just deploying AI solutions to deploy them, or you're not sort of going just where the interest is, right? That's an okay place to start when you're just starting to get some experience organizationally. But in order to really drive value and impact, you need to be really tackling the right, larger strategic problems and needs of the organization.
Great.
I'd add a couple things to this. I think when you're talking about the data quality and completeness, the usability of it, more often than not, organizations have made significant technology investments, but it's not commonly understood that they need to really spend a significant amount of time on the data profiling aspects of what will help you to determine whether or not you've got a workflow that's a candidate. It might be the most inefficient process that you have in the organization, but if your data is not in a state of readiness, your frontline people are going to know that because they already know that they can't trust it. So I think the one additional thing that I think about is and I know probably you are all talking about this too, you really got to design with the people who are going to be impacted and are using the things. Don't build something and then roll it out as a pilot when they haven't even seen it. They won't trust. So it's just really important to do those two things. Your frontline people know the quality of the data. They know whether they can trust it or not. But then they also know the workflows that you're thinking about impacting. So you probably can't bring them in soon enough to the design kind of conversations that you have.
Absolutely. These are such excellent points. Being present with that frontline team that understands what their current workarounds are and why they're doing them, enabling the standardization, but also the flexibility, and then helping people to prepare for what a workflow will look like. All really important, especially as the selection and implementation starts getting ready. Um,
Rachel, can I add on that real quick?
yeah.
So I think that this idea of engaging frontline staff is really critically important because I think it's even when you're thinking about what are the strategic opportunity areas you want to tackle, you really need to be talking with the frontline staff to start to say, am I solving an actual real problem or need in a valid and useful way, right? So, and I think that to be honest, that goes for technology beyond AI, but I think it's even more critical when you're thinking about AI-enabled technology because there is that implicit upfront sort of discomfort and lack of trust that could exist. And, as we started out, we were talking about that sort of pervasive, I think, sentiment around like fear of job loss and things like that. And so, really building together with frontline staff to say, are we solving the right problem is really critical. But it also helps to ensure that ultimately your AI is doing the things that it's supposed to do and solving the problems in a way that's high quality, safe, and valid, right? And so I think it's really important that we are engaging frontline teams and thinking through the solutions that we're implementing, especially when there's AI involved.
Such an excellent point. We never want solutions in search of problems. We're always trying to unearth the problems and find the right solution for them. And to the point of AI being even more acutely obvious that we need to not just put AI-enabled technologies into places. We really need to discern, is this a problem that is real, or have we decided that we want to use something fun, shiny, and new in a way that isn't necessarily helpful? Um, and so as we're kind of thinking through that, we've talked a lot about engaging the front line, which is absolutely critical. But also we need to think about governance. I think, as we come through all of these different components, governance comes up again and again in the conversations. So thinking about the essential governance checks that should occur before implementation, how do you see that? What are those governance checks for you? And how do you ensure that they're meaningful, not just for implementation day one, but for sustainability over time? I'll let Chris start this.
This is an important area for a variety of reasons, but one of the things that's become top of mind in conversations that I've had with people lately is really around the way that we historically have done governance and even regulatory kind of focus on how we're going to operate. We have this false premise that healthcare is static, and it's not. If you think about the practice of medicine, there's an evolution of science that's going on. Facts can change in 24 hours or less. Things that are true today weren't true maybe yesterday. So there's a definite need to have an operational model, and it's not just pre-deployment. You have to start to identify what are the things that we're targeting that we want to actually work on, and then within those, we need to start to identify who are the SMEs that can actually be working alongside of us to help build the embedded monitoring processes that need to be there. Whenever there's any kind of AI influenced decision or even a recommendation, someone has to have a view of how exactly these outcomes are being achieved. They don't need to have to know how to code, and I don't mean all of that, but at least from a basic high level perspective, they need to be able to understand enough so that they can actually explain how it got to a conclusion. And then the next piece of it is an ownership for the outcome. Because when there is an outcome that's not so good, someone needs to be able to, first of all, understand how we got there, and then start to drive the processes to correct those issues. We're talking about living and breathing models here, and it's really, really important we don't lose sight of that, because there's just, context is everything when it comes to how we use AI. Facts that we look at, there's years and years of history on anything under the sun, and the AI believes that it has the necessary information. And I say believe because it acts like it has it. Let me put it that way. It doesn't have an expectation that it's missing information. It's trusting you to give it what it needs, and so it will absolutely process information and make recommendations, sometimes based on facts that yesterday were true, today aren't. Great example, someone shared with me recently. There's some inherent biases in the facts when it comes to labor laws and compensation rates. Data scientists are going to ChatGPT. I've got a job offer. What should I ask for a salary? Well, your name is Chris. It's spelled with a CH. Probably a guy, so I'm going to give him this number. And the facts bear it out historically. But if they start with a KRIST and it's Christine, it's going to give me a whole different number based on facts that are in the history, which is without context. We're leading it into a decision that's not, or a recommendation that's not what we want to do. And that can happen in almost any context you think about, but it's just really, really important to remember the foundation that you're putting in is only one component. That context and the judgment to understand the interpretation and how to do it, you have to build some rigor and some process around that operationally, so you're constantly monitoring and you're watching for these types of things. This isn't academic governance like for a long time we talked about in probably almost every healthcare organization. It's an academic exercise to talk about data governance. Well, really, it was functioning more like a data club. Now we need governance that actually can help us to move the needle and make good decisions, so that we're constantly driving improvement and accuracy in the outcomes that we're setting out to achieve.
Absolutely. Rebecca, Ophelia, would you like to add comment to that?
Yeah, absolutely. So in regards to governance structure, we have all probably been in the situations in which governance structure is code for here's about 6 papers to fill out, sign your name, collect your signatures, go all the way through, find an executive sponsor, and then ultimately, I don't know how many other people have been in this situation, you end up taking somebody for coffee or lunch and hope that you can convince them when you get to the meeting that they get you past the next level. And then you multiply yourself by 8 months later, 12 months later, and hopefully you have connected all the dots and jumped through all the hoops to get to the meeting. We are not fast in healthcare, and this is what's really going to challenge us in 2026, that if we go slow, we will be left behind. If we have governance structures that are slow, and a lot of our hospitals are integrated systems, and we are focusing on systemness, and that's been a conversation for the last couple of years. But we cannot move with the flexibility that we need and the adoption that we need if we have a governance structure that is ultimately tied to, we have standardized papers that we fill out, and make sure you get your capital whether you have it or you don't have it. So I encourage you to go back to your organizations and really kind of look underneath the hood of what are we trying to look at and how are we trying to solve it? Because our structures are going to be key in order to adapt to it. We cannot promise timelines of hitting our targets and meeting our needs if we spend 11 months in just the signing process. And we all probably have goals that have been put on us for 2026. And the big, beautiful bill and some of the other decisions that are happening across the country are going to challenge us to meet our targets. And we know that already in mid-January. So we have to be able to plan for that. The other side of that is we need to pick a owner of this work before we pick a vendor. And sometimes it feels that whatever vendor is selected, a different owner gets decided versus the person who's going to own it. And I think when you look at the ownership level, there should be four roles of ownership. There should be that executive sponsor, that clinical champion, the operation owner, but we really need an owner for AI, focus on an analytics owner who is going to keep us on track and ensure that we have that same measurement across the board and that we're using the same decision making on our AI platforms, regardless of if it's for revenue cycle, hospital ops, or surgery, because it's really easy to get caught in kind of like the weeds and the favoritism and the relationships that occur at conferences, et cetera.
And if I could
Thank
weigh
you.
in, just with regard to the urgency, Rebecca, you made a fantastic point there. And I know that all my colleagues out there that went through the pandemic in New York, you know that we're capable of moving at a whole different pace when we need to, and we can make decisions and move quickly. I would encourage folks to be talking to their leadership teams around how do we bring this same rigor and urgency around how we're going to govern, and let's work on getting this framework up and running so that we don't fall further behind.
Um, Two things come up for me. One, I was not deeply involved in setting up our governance structure at MSK, but I will say one really nice outcome is that our legal regulatory compliance partners are now familiar, aware, and have a little bit more experience in thinking through what AI is, what AI means, and how to think about risk related to it. So what I've found, having the luxury of coming in like after our governance structure has been stood up for like 12 plus months, is that they're much more ready to engage and have conversations and move more quickly and be more nimble because they've had some time, right, to get like really steeped into the details and weeds of what governance is, what it means, and to really be thinking about initial use cases. So the other thing that came up for me as we're talking about governance is actually that continuous learning loop. I think that Chris was really talking about, but really thinking more about the individual's responsibility when it comes to like governance. So this is like little g, not big G, right? And my team really loves Anthropic's 4D model. So in thinking about fluency and the last two Ds really resonate with me in this conversation around governance and sort of like making sure we're being attentive to the outputs of AI, and that's discernment and diligence, right? So discernment meaning being able to build knowledge and ability and empower the user to be able to say, does this feel right? Let me kind of do a mental check about whether the output seems valid. And then diligence, meaning taking on the responsibility to sort of wave your hand and be like, wait, I don't think that this is right. I think we need to look at this and reevaluate, and having a mechanism and knowing what that mechanism is to raise the concern and to be taking the responsibility about when to actually rely upon the AI output or when to say, you know what, I'm going to use my human judgment to make a decision that actually this may not feel right. So how do I adjust or adapt? And then also raise awareness that this is happening.
Excellent. The big G, little g conversation around governance, kind of taking on a couple of different flavors. Healthcare is notorious for its incredibly long evaluation cycle, whether that be a sales cycle or just an evaluation process. Really, Ophelia, to your point, our legal and risk partners, we need to get them involved early because we are historically a very risk-averse industry. We have people's lives at stake. Decisions are not made lightly, but we need to learn together how to make them quickly because there are absolutely some decisions that have impact, and then there are decisions that have quite a big impact. And trying to help everyone involved in the governance team understand which decisions fall into which category. And then as we're talking about the small g governance, as I think that we're hearing here is what does it mean to understand the output model and have a pathway um, for saying, I think there's drift. This is, it used to give me what I felt were good and strong answers. Now I'm feeling like I'm second guessing the output more often than not. And so both the governance at the first level of how do we get it into the system, but the governance of continuation and how do we make sure that everything is working together. So a governance structure that is more complete than perhaps, the set it and forget it of historical IT choices.
I think, Rachel, the other thing, though, I just want to mention is that in order for us to be able to get our organizations to be at that level of ability and maturity, right? To be able to think about discernment, to be able to understand how what their role is, or how to think about if something is valid or not as an output. It requires education, right, around what AI is, what it isn't, what it can, what it's really great at, what are some of the potential like gaps or pitfalls when it comes to AI. So I think that it's also really important that we're thinking about training and enablement a little bit differently than we do with a traditional technology, right? You can't just deploy, models in Epic without really helping to inform people not only about what it means from a workflow perspective, but the fact that there is AI being deployed. What does it mean? What is it doing for you? And what is your responsibility, right? So we sort of need to be really explicit about that education and training around AI and the fact that it's being integrated into workflow and how individuals should be thinking about it.
Absolutely. And kind of to extend that, we are talking a lot about risk management and trust. So when you are thinking of categories of risk, whether that be clinical safety, fairness, bias, privacy, workflow disruptions, what have you seen in kind of your work or experience that you've had? Which one most frequently derails the AI projects or the AI-enabled technologies? And how would you suggest that we start thinking about proactive mitigation? I will open this up to the floor for whoever would like to start.
I'll start and I'll ask my colleagues to chime in on it. So risk is everywhere. So every single day we make decisions, as you mentioned earlier, that is focused on risk. And that's really what makes things not move as fast is we're concerned, so we don't even get out of the gate. There are individuals who will be so scared because they simply don't understand it. And you will never leave the batter's box, so to speak. You will never get to first base. And so when you think of it like a baseball diamond, there's steps. You have to choose to hit, you have to choose to swing, you have to choose to bunt. Please don't strike out. Like that is your mentality. But when you talk about risk, you will strike out at the end of the day, and you will not leave the batter's box if you have not done your due diligence. If you have not gotten risk in particular involved, you haven't gotten legal, if you haven't gotten your front line, if you haven't gained stakeholder acknowledgement and buy-in, you will strike out, and then you're sitting there. Then you go back to the bench. And the part about risk and I hopefully we're in New York, so there's a bunch of Mets and Yankees fans here on this kind of conversation here. But like to do that is how do you get back to the batter's backs? How do you go back in and how do you swing again? And you cannot do that if you lost the trust. And so when you talk about the biases, it's really making sure this is a measure twice, cut once mentality. And I think that's really hard right now when we focus on 2026 and we compare this a little bit to COVID. In COVID, we were throwing spaghetti at the wall and seeing what stuck because we ran out of PPE, we ran out of staff, we had mass retirements. We had to make decisions really, really quickly. And at the end of the day, it became a survival mode. This doesn't feel the same as a COVID survival mode in that you can't navigate the risk in the same way because at the end of the day, it's data that impacts lives. COVID was you're in the weeds, you need to save the life that's in front of you, and that's all you're focused on. Right now, we have all these extra pressures. And so when you're focused on risk, your first thing is IT security. You cannot become a episode of 911 in which you're being hacked and your AI is taking over you. If you saw this last episode, I apologize. I killed the spoiler on you, but you need to be able to do that level of risk acknowledgement. You need to be able to understand your biases, which part of your patient populations are being negatively impacted. And that is not a tagline. That is real. Our marginalized patients are being impacted in this area. And so really being able to dive deep into that, and again, developing that trust and that common language among your teams.
Um, I think Rebecca covered a lot of the organizational imperatives, right? And I think, again, I harp on this just because of where my team is positioned and sort of like how we think about deployment of programs and technologies and things like that. To me, trust is really critical, right? So I sort of look at all the things that Rebecca said as table stakes, right? We need to be thinking about responsible use. We need to be ensuring that our data is the right data. We need to be ensuring there's security in what data we're sharing in these models, et cetera, et cetera. But I think trust is really imperative. And again, it's really thinking about trust in a multifaceted way. So trust means effective, efficient, ethical, and safe, right? So it's all those things. And it also is at multi-level. So it's around the technical and the data side of trust, right? Which is some of what Rebecca touched upon. It's the ethical, privacy, regulatory part of trust. But it's also going back to sort of what I shared at the beginning, it's really the human and organizational trust as well, right? And so I think that that's just an important lens that we need to take when we're thinking about AI adoption. Um, the other thing that was just coming up for me as we think about Rebecca's comment of like we need to be thinking about risk and in all of those ways and being safe, but then we also can't take forever to make decisions. I think the other thing that comes to my mind is there's a lot of hypotheses and assumptions about where AI can provide value to organizations, right? And so, how do we help to create opportunities to actually test? Well, one, be clear on what you think the value is upfront, which I think lots of organizations are not really good at. And so, how do you make sure that you're clear about what value this AI solution is going to bring? And then, how do you actually find mechanisms to test in smaller ways in order to validate before you roll out and scale across like an organization and spend lots of money, right? Because the other risk of moving too fast is AI is expensive. And then you also end up with like this very disparate kind of set of tools and things like that that may solve very like specific point solutions and problems, but then you end up with like this whole array of tools that don't necessarily come together in a coherent way. And that in itself kind of creates risk, right?
Absolutely. The uni tool problem of stringing things together with bubblegum and duct tape, then all of those patches with inconsistency, I mean that just creates risk in and of itself. Rebecca, please.
Yeah, and just adding on to that. So a majority of us do not have the money trees in which we have the cream of the crop and we can choose every AI opportunity that comes up. And so it's going back to that governance, and it's some of that risk is when your clinicians and your frontline caregivers, whether you're 3,000 large or you're 80,000 large, is everybody doesn't understand the background on why there's not an unlimited amount of money and why we can't solve revenue cycle, why we can't solve hospital ops, why we can't solve OR, SPD, and everything in between. But we do have a core function that has a lot of hospitals have already went live with, which comes with its own level of trust, is the impact on clinicians and our frontline caregivers for burnout. And so we have to, as leaders, we have to figure out how do you navigate that priority list and choose, because one hospital will be going live with a nice headline of we're reducing hours on our clinical staff to reduce burnout with no longer having to chart, et cetera. And so then people want to go to that hospital, or there's a mistrust on how it went live. It's not just pizza parties for going live. And so it's really being able to get into that. But on the other side is you have other parts of the organization on where you see there's a financial ROI. And how do you tie that to burnout? How do you level the same with between burnout to AI collections and the amount of money that is lost on billing and coding? And so really being able to find that balance in how you navigate those conversations and also you prioritize is really critical. Both are extremely important. Having our physicians and our clinicians and frontline staff being able to feel safe in the workplace, being able to focus at the top of license needs to be our core function. Without them, we have nothing at the end of the day. So really being able to keep that as a focus. But also I saw in the chat, how do you navigate that ROI conversation on things like revenue cycle and coding to be able to maximize that? So all of that are risk conversations that occur.
You mentioned the ROI piece of it, and I think we're talking about the level of burnout from a clinical perspective that we're seeing across the country, coupled with shortages for nursing staff in a lot of physician specialties and even primary care. There's a risk for not moving fast enough to relieve that burden, and that's something we've got to be keenly aware of. We have to be really looking for the ways that we can move forward and be the people that are saying, yes, we can do this. And I don't mean that we're saying it flippantly, but there's a lot of people that are going to be willing to pump the brakes. And I love them because they're brilliant at it. But some of us are going to have to try to push that envelope as much as we can. We're going to accept the guardrails, of course, but we can't just withdraw and call it a day because it's a little bit difficult. We really have to solve these problems. It is going to impact patient care because it's impacting our frontline staff that are taking care of the patients.
That's such a valuable thing to remember, right? Everything that we've put into our healthcare systems came with people who were kind of pushing the edge a little more than made people comfortable. Uh, and AI in particular seems to be something that people want to be near, but not involved with. It's the let me be close to it because I'm interested in what's happening, but I'm not sure that I want to take ownership of it, given all of the complexities around it. Um, Talking through the ROI and would love to just kind of hear what your thoughts on this are, because we experience this in my shop where there are easy, and I will put that in very heavy quotations, ways to measure direct ROI in back office functions. You have more claims adjudicated, you had better coding. Okay, that makes sense to people. When we start getting into the ROI around time and burnout, it feels softer. And sometimes that conversation takes a different tone. Not that it's not important, but how do you navigate that kind of, I will say, softer ROI numbers when you are in discussions with leadership or the finance team?
Yeah, I mean, I think that that's a great question. From my perspective, the way we've been approaching it is upfront, talking about the fact that there's like four buckets of value, right? And I think that this is true again, not just for AI, but just generally speaking. There's, we think about it as there's like hard financial dollars, right? So that's, maybe it's you can do something more efficiently and no longer need this external third party, right, to do something for you, or you're reducing a contract or things like that. So very tangible hard dollars. And then there's process efficiency, which sometimes, depending upon what the process is and what the efficiency gain is, may not actually mean reduction in like total FTEs, for instance, right? Because if you're eliminating parts of people's work, it's really giving them the ability to do more, right? With the same amount of people and resources. So thinking about efficiency and how to measure that. But then it's also about making sure that upfront you're clear that there's value from a user experience perspective, whether that's staff, patients, external consumers, caregivers, whatever it may be, and be really clear about that. And then also in the last bucket, we normally think about like quality, safety, regulatory value, right? So I think part of it is really being upfront and talking about ROI is not necessarily just hard financial dollars, but really starting to create a conversation to say value can look like many different things. And then organizationally and kind of specific to the problem or the solution you're suggesting, you need to sort of evaluate what's most important and a driving like decision factor, right?
Yeah, I just said there's also the cost of lost opportunity as well, which is not usually baked into an ROI kind of conversation, but I think it's an important one to keep on the radar. And this is probably going to seem a little abstract, but we're talking about something that we've never seen before in terms of the scale of disruption this capability is bringing to us. I was talking to a chief innovation officer a while back, and they had to convince the organization and the board that we needed to go transition to the cloud. And I said, well, how did you pitch that? When they asked the inevitable, what's the ROI? And they said, well, what's the ROI of electricity? It kind of jarred me. I'm like, I get the point, because we're talking about something that is so transformative. It has to be looked at differently. And we're not, some of the typical approaches that we try to apply, they just don't fit in this scenario. So we just need to be mindful of that. We know what we've done historically, and all of us have different thoughts around what could have been done better and where we really missed the boat. But this is a whole nother thing, and it really is it's an important thing for people that are listening in today, and for all of us. Just be mindful of that, and have the courage to stand up and say, you know what, we do have to do this. And it's hard, but let's figure it out together, because it's our community that's really depending on us to deliver. They need to have a better quality of care. They need to have better access to care. And if we can't solve it, no one's going to.
I just want to call out, though, that there's a huge gap between, and this is really what the hype is, right? There's a huge gap between the aspiration of what AI can bring and what people are actually experiencing. So I think that that's important to at least acknowledge, right? Because I think one, it feels like every other organization is doing these amazing things around AI and have seen all these like all this value, right? They've deployed so many things, but the reality is, at least in my experience, as I'm talking with other people, we're all still learning. And even when you talk to people across other industries about their experiences with AI, it's totally true too, right? So I think that that's just an important acknowledgement, right? It's so yes, healthcare moves slow. Yes, I think that we traditionally have a very risk adverse, mindset, but we also sort of need to know that we're not that far behind other people, to be quite honest, right? Because we are still learning. And I mean, I think the potential is really, there's huge potential for AI, not just in care delivery, but in science and driving research and things like that. But we're all still learning. It's still early days, right? And I think that we sort of need to understand that too, because it's not like there's this playbook that you literally can just say like, oh my gosh, look at what all these organizations did. I'm going to just lift and shift that, right? And so anyway, so I just want to really like acknowledge that, because, even for myself saying like I have experience in this, my experience has been like 9 months deep diving into how we deploy this organizationally, right? And I've learned a lot, and I certainly have a perspective, but it's not like we've nailed it, right?
And I think that's an important point you make, because we all know that there's a bunch of buzzwords out there that people use all the time. And
Yes.
they may tell you they're doing this great thing with AI, and what they've really done is they've automated something with a robotic process automation or something.
Yes.
And that there's got to be you got to take things with a grain of salt. We're not that
Yeah.
far behind,
Yeah.
and people probably are not where they're telling us they are, basically because they don't understand. They're not even close enough to it to really understand. If it's a measurable bottom line number that's creating margin, or if it's improving quality and we can verify that, great. But I don't see that there's a lot of that out there, at least not in the public arena from what I've been seeing. Now, there's some really good reasons to be excited and hopeful, But I think to your point, I think we're all still learning.
And just kind of touching on that. So when we focus on ROI, in order to get an ROI, you also have to have money to spend to try to get one back. And so we can't ignore that. And going back to like Rachel's question on kind of how do you prioritize the soft stuff? So the touch, I'm gonna call it the touchy-feely, the trust that creates, and some of the you can't, it's really hard at the end of the day to put the financial value on a physician not charting for 3 hours when they go home that night. And what is that value? We all know it at the simplest form. It's that physician being able to get the long license out of them being able to continue and not having a constant turnover, them being able to want to come to work, them wanting to tell their colleagues that this is a great place to be, not and you're not in an institution that hasn't invested into the satisfying members of being able to satisfy your staff and your front line. That is, to me, that is the bottom line. That is the bottom line that if you're not making that investment and you're only focused, and we all have been there, we all have been there and where you've had to focus on the ROI of, I have a gap of 20 million, 50 million, 120 million. Those are real numbers that a lot of us are hearing every single day and your cash on hand. So you're looking for a very fast turn and you're hoping for what almost is kind of close to a miracle when, to Chris's point and Ophelia's, we all only have 8 months, 9 months into even knowing this. And so one, I say on ROIs, you got to level set your expectations. Otherwise, we're all kind of going to be going down. It's the blind leading the blind in this. And you can't, again, I said it earlier, but you have to measure twice and cut once. If you lose the trust and you go after just trying to close the $50 million gap, the $80 million gap, whatever your magic number is, you might be disappointed at the end of your outcome. And so there's a lot of impact and it's really promising. It's really exciting. But really being able to going back to that governance structure of how you make those decisions and what decisions you make and when you make them and what levers you pull from are going to be critical. I think, and last thing I'll say on that is as you talk with your colleagues and you talk with your clinical partners, being able to show a roadmap. It's not saying, dear Dr. So-and-so, we're not focusing on ambient listening in the ambulatory clinics, but we're going to focus here on quality first. And this is the roadmap to get here. More transparency we can show on where we are now and acknowledging that we don't have all the answers and we may have to pivot, but showing the parts that we're trying to accomplish on the way will continue to build that trust and ultimately lead to the ROI. Whether our CFOs and our COOs say that the ROI is sufficient enough is debatable, but we will be doing it at least the right way.
Such an exceptional point that you've all made around, we are looking for urgency around the returns here, but to kind of a comment that was made earlier, we don't necessarily have the right data or data structures to be able to get that level of return so quickly. And so to the point of, is there something that we can do upfront that allows us to build that sense of trust with our clinical community, our administrative community, while we get our data house in order to be able to have some of these more wow style implementations where we start seeing bigger returns, more obvious implementations where lots of people see the same impact. But to the point of we're probably going to need to do this in steps. And since we don't yet know what we don't know, it becomes a very process oriented, let's roadmap this, let's see where we can get in the next 6 months. And what has changed in the world of technology in 6 months seems to be accelerating over time. There are a couple of questions here around the intersectionality of our for-profit entities, whether that be, an Anthropic or an OpenAI, and the healthcare systems. Have any of you had the experience of exploring those style of partnerships, or anything that, is exciting to you there, concerning to you about that? I'll open that up as a pretty broad question.
So, 2 weeks ago, we announced we're an early adopter partner for ChatGPT for healthcare. So this is a new collaboration for us with OpenAI. Certainly organizationally, we've had a enterprise Gen AI portal that had a number of different large language models available internally to our staff. But the way that I see it is, at least in terms of this particular partnership that we're just kind of just kicking off, to be quite honest, I actually think that it's going to help us accelerate our AI knowledge and adoption organizationally because it's more of a um, top-down facilitated initiative rather than we have this tool and whoever wants to use it can use it. It'll have more guardrails around the how we want to support people to use these tools. But more than anything, I'm excited about the enablement resources that come with a partnership like this, right? So for us to be able to train 1,000 users on how to start to feel comfortable with large language models, how to prompt write, how to think about use case development, it's we certainly could get there, but through this partnership, we're going to get there a lot faster, right? And I do think it will be interesting to see what the what their product continues to be evolve into and there are, I'll just be upfront in that there are guardrails, right, around use of data, privacy, all the PHI protection, IP protection, all those things. And so that's important, like a really important foundation to any of these kinds of relationships, because I think all healthcare organizations are hyper not just cautious, but like hyper vigilant around all of that, right? Because it's really fundamentally a critical part of our responsibility. So I'm excited about that, and I think going back to something that was coming up for me related to that, but sort of in the risk category, is I think we need to recognize that not everyone, but a large number of our staff are out there using these large language models themselves, regardless of whether the organization has like a sanctioned tool or training to help support them. And so, and I think that there's a difference between using like a large language model versus like some of these more custom built tools that take larger development, deployment, et cetera, right? And it requires a different level of support. But I do think it's important that organizations recognize that people are using these tools regardless of whether it's part of your official set or suite of tools or not, right? And so how do you make sure that you're helping to actually drive the safe and productive, effective use of these tools within your organization, right? And for us, like that's what this partnership with ChatGPT is going to really enable us to do, is to drive more of that knowledge and awareness and greater focus on where a tool like a large language model can actually bring value to us.
Any other thoughts on kind of that, I'll say, for-profit or startups and healthcare system partnerships?
I think there's a lot of potential value there, but there's still some pretty unsettled territory that we're going to see over the next few months, unfortunately, because of some lawsuits and other things that are really around how the data is being used, how well it's documented. Are we getting the right level of consent? Is it explicit enough, or is it not? Is there documentation being generated and put into the record? Okay, well, these systems are classified as administrative right now, not clinical. So the only person going to be in trouble is the person who signs off on whatever the output is. These things are going to be a little dicey for a bit. But I think that the potential for these relationships, like with ChatGPT, when we're talking about OpenAI and Anthropic, I mean, it's very exciting. But I think to your point, we really need to make sure that we're helping our team members to understand which tools that we sanctioned, and then make sure that they understand what limitations there are for using the same technology outside of the organization that doesn't have the benefit of the same training that's been done inside the organization, especially anything to do with clinical care or any kind of even proprietary information or confidential information about your organization. I might know some financial things that I can go find in the public domain, but there's some nuance that I might understand as an employee that if I go in the public domain and I'm putting in prompts that are essentially training these outside models, there's potential risks to cross some lines I don't intend to cross, and there could be unintended consequences for that. But I think these are the kinds of things that leaders need to be thinking about. How do we provide the guidance so people know what you can use it for and where some of the boundaries are you want to stay clear of? Whether it's personal or inside, you can control things inside of the firewall, but much harder to do that once someone leaves the building.
Right. I think the other thing that I'll just add outside of like large language models is that um, most of our organizations, we're not set up as technology software companies, et cetera, right? And this technology is moving so fast. So even in an organization like MSK, where we have, an internal AI ML team that has some knowledge and experience and things like that, we can't move as quickly or nor can we like assume that we're going to have the same level of expertise and experience as some of these other external companies, right? And so I think when we think about beyond just large language models and maybe more purpose-built tools, there's a real opportunity to think about how to identify the right partners in order to be able to develop those things versus sort of assume that we have the knowledge and expertise to develop them internally, right? Sometimes that might be the case depending upon what the problem is and what the tool is, but being able to think more purposely about when those external collaborations and development opportunities might actually benefit you to move faster, learn faster, fail faster, right? And then get a better solution. So I think that that's the other part of thinking about that collaboration or co-development with external for-profit technology companies.
And just adding on the co-development, I feel like it's also an opportunity to, again, empower your staff. Some of that kind of gets lost on the day-to-day because we're so busy. There's so many things to do. But there was a lot of healthcare organization had a lot of really great ideas that came out going back to COVID at the frontline level that came about because people had the opportunity to think outside the box, and they were trusted with that throwing spaghetti at the wall mentality. But going into kind of like that for-profit and co-development, there's an opportunity for ChatGPT. Obviously, is a name that everybody knows, regardless of what dinner table you're sitting at, type of mentality. But there's thousands and thousands of other companies that have 2 employees to 180 employees and everything in between that has opportunities for hospitals to co-develop. And how do you motivate your own staff? And you kind of talk about change management and the incentives around it, but how do you create some of that to really get that measurement and like continuing measuring what matters, but you get to be a part of the solution and not the solutions that have came to you from the Silicon Valleys and things like that.
It's such a really an interesting place to be as we want to empower our frontline staff. As a business of healthcare, we are looking for the ROI. But as a business that is a startup, I've had the pleasure of working with several who are using machine learning to help better identify and match breast cancer patients to an effective treatment. But they can only do that if they have enough data to train their models on. And so you start sitting in this interesting space of, can healthcare systems learn to take on risk or do data sharing agreements differently so that we can improve the outcomes for our patients in a way that we're just not used to doing. And I think you're all talking about that a little bit of we need to rethink. This is not just a you're buying data from us, right? No one likes that feeling, but we have a ton of data that is the biggest currency that most healthcare systems have. And how can we use that to accelerate betterment of the entire care delivery from diagnostics through treatment? And I think that conversation will continue to evolve as we get better with the machine learning elements of everything that we are looking at, but also as our data in our healthcare systems evolves and starts to be cleaned up in a way that is useful, not just internally, but potential for other development areas. One of the other questions, and this is something that's close to my heart because I've spent some time thinking about this. I don't know how much everybody has either engaged with or spent time thinking about agentic AI, or places that you see there to be advantage in both the near and long term. But for AI agents, what is your experience? What are you excited about? And is there anything that you would put forward for people to be thinking about closely?
I think I go back to the idea that it sounds like a really promising and exciting opportunity. To be honest, I don't think that we're at a place where we're quite ready to be like, okay, we're going to create these AI, agentic AI flows, et cetera, right? I think that we have some of the technology infrastructure, but I don't think maturity wise, our users are quite at the place where they can really wrap their head around like, what does this actually look like? On the other hand, healthcare is like rife with like really manual processes where it really is not value added to have a person be doing some of these tasks, right? I mean, like when I think about clinical research, and we have a huge clinical research enterprise, the amount of manual data entry from one place to another, just because a sponsor wants it in a different format, in a different place, et cetera, is sort of mind-boggling, right? So I think that there's so many opportunities. But like we're not yet at a place where we have like launched something. I think that there's a lot of learning and thinking about what are the right opportunities and how to approach it. But again, I think that there's a lot of real places where agentic AI could drive huge efficiencies organizationally, and we're all people resource strapped too, right? And so I think it could provide a lot of value. And it could really help us to think about like how to think about healthcare delivery in the future and really transform how it works. I'll just mention I was in a conference maybe like 9 months ago, and it was an interesting dynamic because there were individuals from the healthcare provider space, but then also from like the insurance and payer space. And there's this idea came up. It was not really like a positive idea. It was more of a sort of it had some animus underneath it, but where they were talking about it'll be our insurance bot versus your insurance bot fighting each other over whether something gets paid, right? So you can imagine that ultimately, in the end, instead of putting people hours to something like that, maybe we can leverage technology for it. I mean, hopefully in the end, it'll drive us to rethink our processes versus but at least in the meantime, we could perhaps eliminate some of that, like the people resource intensivity around activities like that.
And there's a lot of value to be gained in certain areas for sure. There's a few things that I've just played around with for my own benefit, really heavily in researching things. I mean, it doesn't really matter which topic you're thinking about. There are certain tools that actually are very, very well put together that will actually go and pull resources for you. They'll bring you the citations, they'll bring you the links to the documents so that you can actually see the source of it. I've used that a few times recently for some very short notice requests to answer some from some journalists. And I mean, it's so much different now than it was before. Just having that kind of capability to just go and research almost anything you want. The upside for me is like, well, what if we can really get this to a point where our data is ready and we can enable research the way that we really could? And I mean, that's one of the reasons when I was in New York that I actually wanted to be in New York, because the data in that environment is so rich and diverse. If we can just figure out how do we harness it, I mean, agentic AI could be a game changer globally. We just have to make sure that we're doing the hard work of getting the data in this spot where it's really accessible and usable. And I think the traditional approaches to doing that even have to be re-looked at as well. We need to be able to use the technology the way it's designed, and it's unbelievably faster now than it was 5 years ago. But that speed at processing information, and of course the proliferation of it, we've got to figure out how do we use that, how do we do the normalization kind of activities, using these capabilities to where people can get to that confidence level sooner than later so that it can be really valuable from a research standpoint.
And just kind of wrapping with that is that like one of the really like easy case examples that we all have in our hospitals and ambulatory areas is looking at breast cancer screening exams or colonoscopies. There's really easy examples of being able to agentic AI through that, being able to have my chart send out a message of, hey, Becca, like you haven't had your colonoscopy screening coming up. Here we found a date availability of May 10th, and does that work for you? And so really being able to go to your patients. And again, our patients are getting that, whether it's DoorDash or it's the hair salon or it's an apartment complex, they're already seeing these examples in their everyday life. We have an opportunity in healthcare to simplify and improve those patient experience opportunities while also being able to reach individuals who may have not shown up until it's too late, or they never scheduled that colonoscopy, or they never scheduled their breast exam. And so really being able to meet our patients where they're at and jump on the opportunities that so many other industries are already using in just really basic interactions with our patients.
Uh, so many different opportunities, whether it is in the back end for research, it's in the front end for outreach. One of the favorite kind of thought exercises is, what would you do with someone who could relentlessly call a lab to get the results that you need so that a human doesn't have to do that? And we can then incorporate that into a portfolio of readiness checklist. The relentlessness of agents is going to be wonderful in some cases, unless you end up dealing with them. But I think that, Ophelia, to your point, where we start having agents dealing with agents, and as we kind of come full circle on the how do we start preparing our teams to say, do you know how to manage agents, right? You don't have to follow their steps, but you do need to be able to make them goal oriented, and you have to give them access to the right systems, and you have to limit their access to the wrong systems. These are all things that are interesting to think about. I don't necessarily think everybody is there yet. I think in small pockets, we might be getting close. But really shifting where the work is done and moving the human side of work to where the human needs to be. Just an interesting thought experiment between what do we want agents doing and what do we really want the humans to do. So I'll encourage everybody to continue to put their questions in the chat. I don't know, Halim, do we have any that have not been answered or that I have not seen?
Yeah, I mean, there may be some bits and pieces of the questions that we have that haven't necessarily been touched by the panel. So I'm going to take one of the questions, and it goes back to the risk thing. And it says, what is the risk of putting ROI in front of the advantages that AI can bring to the whole experience?
So Halim, it sounds like if we're using ROI as the primary stage gate, so if we
Mhm.
can't come up with a hard ROI, um, what are we foregoing, and that opportunity cost of if we don't have hard dollars. So I think that's another potential way to frame that. Does that work?
I love the way you said that, Rachel. I think when you're dealing with the dynamics that we have in individual markets, there's often enough difference between people who are early adopters and those who aren't that it actually starts to affect where the patients go to get their care. So, what's the cost to us if we don't move on something? Can someone get the same standard of care that we're not doing? Can they get that somewhere else without a whole lot of inconvenience? If the answer is yes, we have to take that into account too. I think oftentimes we miss that when we're looking at the market dynamics component of things. We're projecting volumes, we're projecting cost and expense, but what about the business that goes elsewhere? That's something we have to look at as well. There's a lot more factors to the ROI than just the bottom line stuff.
Yeah, for me, I
Anyway,
think it goes back to the discussion we had earlier about like thinking about value in a multifaceted way. And so, but as we've been talking about too, healthcare provider organizations are also in a very challenging financial position. So we have to be responsible in thinking about what is the value that these usually fairly large investments, right, require. But it's a tricky balance because, as Chris mentioned earlier, we need to not also put aside the potential aspiration and transformational opportunity that AI technology brings too. So it's tricky. It's not there is a risk if it's a single faceted, like hard dollar ROI stage gate, but it is a critically important consideration.
And I think just adding to that, we are all going to be at different places in our journey, depending on what type of organization that we are at. Some people on this call may be like internally laughing, to be honest, of like, we can't even have a conversation about AI because we have aging infrastructure. We have real problems. We have lack of OR equipment. We have lack of sterilizers. We have all these things that haven't been able to be updated because of post-COVID, and we are constantly counting our cash on hand. And those are real issues. And so it's really hard to even jump into what is kind of feels a little fantasy slash it's right in our face of reality of an AI conversation. And a lot of that, it goes back to the importance of governance and the importance of really strategic priorities at where your organization is at this moment time might not be the same as one that's in the Midwest, one that's on the West Coast, one that's sitting on the island, and everybody in between. And so you really have to make decisions about what is your ROI as your institution. And I think it gets hard. There's going to be presentations like this and conferences of everything that's worked at all these other 4,000 hospitals, but you all know your hospital the best and what your priority is and what your priority between your four walls and your ASCs and your ambulatory centers and labs may not be the same as your colleagues across the country who have big names tied to them or little names and everything in between. So really having a core foundation to that, I think, is really critical.
thank
I
you.
will I will add just kind of for that point, just because the institution that you are working within is not in a position to do a large expenditure on AI, that doesn't mean that you yourself cannot do some investigation, have a level of understanding, because at some point this will be either not as expensive or so wildly expensive that no one can use it, right? I think that we're probably going to end up in a barbell situation. Right now, it's priced to be used, but it may be priced for, um, you know, to create revenue in the future, or it could be priced as a commodity. And so you yourself have the opportunity to understand lots of different aspects of where it could be used. And so as the organization starts to get its arms around finances, you may be able to best direct where that first use case could be because you have a deeper understanding and because you've had conversations with colleagues to say, yeah, it's not worth trying this first because it's such a long road. This shorter duration project is actually where more of the value can be found.
Another question that we had was that he says, I'm noticing the increased intersectionality between the for-profit and healthcare sector around AI and machine learning. Can you speak on the benefits and concerns you may have seen in your experience on this burgeoning collaboration?
I think that we had a little bit of conversation around that in terms of, MSK and ChatGPT and trying to figure out where we are. But if anyone has any additional comments, or, as we're seeing it in the clinical side, I see here that, people are very excited about the positive impact on the clinical side. And I definitely don't want to push that aside. There is real benefit. And it will be interesting to see how that continues to advance.
I think Rachel, that comment stood out to me, and I'm glad you called it out because I agree. Like a lot of what we've been talking about are like trials and tribulations and potential value, and I do think that that there are some really promising use cases and demonstrated value at smaller scale, right? So I go back to though that thinking about how to actually scale some of these early kind of wins in terms of clinical use and research use and how to actually scale that within not only just a enterprise, but across different enterprises is sort of the challenge and the question, right? So how do you actually bring some of these these solutions that are actually demonstrating real impact and value to scale? That's still the challenge, right? I don't think that we've really seen that robustly done within healthcare.
One other angle I think about is there's so many startup companies out there that have solutions that are probably phenomenal, but many of them are only handling one subsection of a workflow that's massive. And it's not possible for us to go and implement every one of those things to actually fill a certain gap. But I think the starting point, if it's you and your organization identifying a pain point that you want to work on, and you've got the ability to get your hands around the data, then finding a partner that has something in that space or is already at least somewhere along the pathway of developing something, those partnerships may be the only reason you can make progress. What are they willing to invest? Because it behooves them to build something successful with you. If they can make you successful, they can become successful in their business. So it's a little bit more of an effort an onus on the healthcare leadership within an organization to decide who are you going to reach out to. But you got to do the due diligence, understand how they think, what kind of security things have they thought about, what are they doing about transparency, explainability, all the things that we know we're going to have to provide from a regulatory standpoint before we deploy anything, particularly if it's influencing patient care. But those partnerships could be increasingly more valuable. You're probably not going to find a lot of the big players willing to throw $100 million out. But organizations that I've talked to that have actually had effective partnerships, it really was treated like a partnership, meaning that they expected to invest their time, their energy, and their revenue alongside of you to deliver on what the potential value could be. And it's not easy to maybe negotiate some of those deals, but they've got to be outcomes based to a certain point. And there's a lot of starving startups out there. Mm-hmm. And I think you might find they're more willing than they've been before.
We just had our last question come up in the chat. It says, should healthcare systems offer education around the intelligent use of available AI resources as part of the annual training? For example, our institution has been promoting the use of ChatGPT and Gemini for discharge summaries. However, there is limited education and monitoring of the output.
I would say absolutely. It's definitely needed. And you need to be able to build it, that it's not one that everyone's just pressing click, click, click through. Not that anybody on this call is guilty of that, but In case you are, you really need to make sure it's interactive. If you're investing the money at the end of the day into some type of AI software, you want to make sure not just at the quarterly reviews that people are utilizing it to its full potential. This is, again, I said it before, this is a measure twice, cut once mentality. You're not going to get a lot of chances to make mistakes in this. And so you need to get your entire workforce on the same page. Go lives go terrible when things live in isolated areas and it's not going from the ground up. It was mentioned earlier, I think by Ophelia, that leaders don't need to be approving this. It's operators that need to be able to utilize this. There's a lot of executives on this call, and so that's our opportunity to take a step back and making sure that our frontline and our middle management is really in on these conversations and not just getting what the outcome is of it, and really being able to have that conversation flowing. And I think when you focus on kind of that education, there's the opportunity to build incentives in this area to motivate our staff, motivate our providers. Maybe it's being able to motivate nurse managers on tying incentives around staffing variances if they're utilizing the models. Being able to tie it to schedulers being related to block release. There's a ton of use examples that you can get in promoting the education and promoting an incentive around it. There's an investment that needs to be made, but really being able to challenge that behavioral change in order to, again, it was mentioned earlier by Rachel, that the AI is going to get better and better, more use cases you can do. And so really making sure you're utilizing the right use cases to ensure the right outcomes.
Halim, I know that we have two more questions that have just popped up in the chat, but we are coming right to the end of our time now. And I'd really like to make sure that the panelists get to give any last thoughts, and we'll try and answer the questions in a kind of follow-up message or of some nature. So, Chris, if you want to kick us off, and then we'll circle around.
Sure. Well, thank you all for having me, and for those that are listening, thank you for listening. And these are really transformative moments in time. In as much as it's a little scary, I think it's also very, very exciting. The future's bright. It's just going to require a lot of smart people like us to roll up our sleeves and be willing to do the hard work. It's our friends, neighbors, family members, hopefully not any of us individually, but inevitably we need to make sure that our clinicians have the best capabilities available to them. They need the best information at the point of care to make really well-informed decisions and eliminate as much risk as possible. This is not easy work, but it is incredibly important work. And I'm optimistic because I know so many of you bring the same kind of due diligence to what you do as the people that put them, did the first moon landing. I mean, this is really important work. And having worked in New York, I know there's plenty of passion, there's plenty of brain power. And, I'm just excited to see where we can go together. So be courageous, push back where you have to, but find the ways where you can enable the decision making and help this capability to advance, to be able to serve not only your communities, but also serve your teams.
Rebecca?
Yeah, just adding to that, again, this is going to be really complicated stuff, and we're all going to be drinking from a fire hose and having to move as quickly as we can while also learning. Again, just there's no good blueprint right now to go through with that. I think you have to be willing to take chances and take a little bit more risk than you would have previously. Do so in a safe and compliant way. Make sure you have your backup before you start making any decisions, and that you again have that structured process. In the world of not trying to boil the ocean, you really need to prioritize your use cases and making sure that you're measuring what matters. You have the right outlines, you have the right incentives in play to ensure compliance. You have all the right stakeholders there. From clinicians to administrations to your compliance teams. You have the time to run pilots. Pilots are hard work and they take a lot of efforts. They take a lot of strategic on being able to do that. So make sure you have the right players in to run a pilot successfully. Trying to touch one of the questions on how to get your site to be that pilot site. you really have to do the outreach. I think if you have a big name tied to you, you got people coming to you, so you don't have to worry about that. If you are not a big name, then do your homework and have a uniformed standpoint. There's a lot of people who may be reaching out through their networks to try to find it, and they're just going to bring their favorite product here to your location, but really being able to have a standardized focus.
Awesome. And Ophelia?
I think two things that are top of mind for me. I'm going to go back to just a recognition that while it may seem that everyone has a fundamental understanding of what AI is, they don't, and that includes your C-suite. So don't make that assumption. I think it's really important to ensure that if you're helping to lead or foster discussion about the value and use of AI at your organization, that you're spending some time just doing some level setting even with C-suite leaders, right? Because people will not be so transparent about what they don't know. So it's really important to make sure that all the leaders have a shared understanding in order for them then to be able to really support and empower staff. The second thing that I want to leave folks with is that AI adoption is a journey, both for the organization and for individuals, and I think that that's important to understand. So, how do you think about building capability, competence, and then confidence? And how AI can actually be used within your organizations or as an individual within your workflows, because then ultimately that will help to enhance the humans within our workforce, right? And really identify where the technology can augment, automate, and support, right? So really truly leading to true redesign and transformation of how we deliver care within our organizations.
I will say thank you all so much for sharing your insights and experience. I will turn this back over to the HLNY team for final closing remarks.
Thank you. Gina?
Hi, everyone. For those who can stay on, we'll just wrap up with a couple helpful information slides for you. My name is Gina Valzen. I am the HLNY 2026 President-elect. I just want to thank Rachel and Halim, who spoke about this at Congress last year, the idea for this session. It was tremendously valuable. And to all of the panelists, thank you so much for your insights on how to implement AI thoughtfully and in a manner that creates trust. It was really stimulating. Upcoming events. Next slide, Evelyn. As we wrap up, I'd like to share about some of the events that you can look forward to next month. In recognition of World Cancer Day, we do have an in-person program on February 3rd, focused on prevention, access, and awareness of cancer care, moderated by our HLNY past president, Allison Roditi. It offers 1.5 ACHE in-person credits, and it'll be held at the Tillis Center in Long Island. On February 12th, we have a virtual program called the Executive Path, which focuses on how graduate educated professionals are leveraging their degrees, navigating advancement in healthcare leadership, and that offers 1.5 hours of ACHE virtual interactive education credit. To stay up to date with the HLNY programs this year, if you haven't already, navigate to the HLNY website at hlny.org/calendar. You can scroll to the bottom and subscribe to our calendar. With all of our educational programs, it's, a critical part of acquiring credits. Oh, if you can go to the FACHE slide. Thank you. You can acquire those credits to certify or recertify for the Fellow of the American College of Healthcare Executives credential. The FACHE is the gold standard and board certification recognition for professionals with mastery in healthcare leadership. If you have been interested to pursue this credential, this is the greatest time to take that step. Applying between March 1st and June 30th, you'll have the Board of Governors exam actually waived. That fee is a value of up to $225. I took advantage of that last year and was able to pass the exam later in the year. So look forward to convocation at ACHE Congress in Houston this March. If you have any questions about advancement, just email advancement@hlny.org. The foundation. So I wanted to share a little bit about our sister organization, the Foundation for Healthcare Leaders of New York, which is our not-for-profit 501c3 organization partner that provides scholarships, mentorship, and financial assistance for future healthcare leaders. I know Nicholas Vilas, the HLNY past president and chair of the foundation board, is on the call. We have 3 scholarships available: the Gianelli ACHE Congress Scholarship, brought to us by Arthur and Sharon Gianelli, the Leonard Utchin Senior Scholarship, as well as the Skanga Family Scholarship from our past presidents, John and Fred Skanga, that helps support paying off student debt, which is wonderful. If you are interested in donating, please scan that QR code at the top to help us lift up the next generation of healthcare leaders. Halim shared in his president's newsletter last week about more collaborations to come with the foundation, and you'll hear more about that later in the year. Our sponsors, we couldn't do any of this without our sponsors. We thank you for really believing in the mission of HLNY and helping us to advance our profession. If you'd like to be a sponsor of HLNY, we have multiple packages to consider, from event specific to annual sponsorship at various levels. Next slide, please. You can contact sponsors at hlny.org if interested to do that. And in the final slide, if you're not following us already, please scan the QR code here, which has our LinkedIn tree, our linked tree, which provides the links to all of our platforms. Follow us on LinkedIn for frequent updates, our website, YouTube, Instagram. And for any questions on your membership with HLNY, please contact membership@hlny.org. And with that, I will pass it back to Nan from ACHE.
Thanks, Gina. I appreciate everyone that stayed on. As you saw, I put that link in the chat. Feel free to go ahead and do the evaluation from that. But thank you to everyone that was attending today. Thank you to our chapter, to our panelists, to our moderator for an outstanding session. The evaluation's open for 1 week. You can find that link by going to ACHE page and clicking on My Online Learning. You'll also find the recording in that section, and you'll also eventually find the education credits in the My Education Credits section of your ACHE account. That does conclude the session, which is copyrighted in 2026 by the American College of Healthcare Executives. All rights are reserved. Thank you, everyone. Have a really great rest of your day.